is different. For that reason, AIM has often worked with people who are living with HIV and they never wanted to be identified in the church. So we've been working with everybody out there who has HIV, but very few because church members can't afford to be known to have HIV. Anakonda zangoso nye anombunga nyezi azvuruga na nyekume na vantu nohame nomongeri kavakara nokupera wanya onye nyekara utigunene Yesu digunene muntu akakuizire akakulika kwaka kuyunga samena kana nowera. So we have repackaged ourselves to say that we are dealing with people who are threatened by HIV, infected by HIV, or affected by HIV. Ano iyonyesi nene kwaka deme nanyo vantu vakara nyesi vakara novera wanyo ontani na vava ya urukuguma yokuhamena kovera o. So maybe that's why you are beginning to hear more, because we are pushing more and more to everybody else who is threatened, which is all of us, right? You live in a place where they say HIV, you are threatened by HIV. So we are now coming into the churches and we are talking to you because you are threatened too. Don't think about those who have HIV. Think about yourself. And in the church structure, the health ministries leader at the church is the AIM coordinator of the church. Can I say health ministries leaders, whether from the church, the conference, or the union? If you are here, can I see your hands? Health ministries leaders? Where are these health leaders? In the morning I saw them. They are not here. Can you see them? I don't see the hands. Okay. You tell them that we were talking about them, because you come from churches, you know a health ministries leaders. You tell them they missed a training where they're supposed to be trained on some of the things they're meant to be doing. That health ministries leader that you have in your church, I assume you have one. That is your AIM coordinator. If he or she does not know about AIM, tell them to contact the conference so they can be taught, so that they can be AIM in the churches. Right, my leader? We work with a mission and a vision. Because your leaders are not here, I would appreciate you going and tell them that there's a vision in our department. We are responding to the HIV pandemic in accordance with biblical principles. We emphasize biblical principles because people have many ways of dealing with HIV. They are not all biblical. And our mission is to be a grace-filled ministry. And we demonstrate the hope and love of Jesus Christ. Why do we say that? Because HIV, as I said before, leads to stigma and discrimination. Yes. People need hope, they need love, they need Jesus in their lives, even when they are living with HIV. And this is what this ministry exists for. Yes. And we work with all levels of the church, starting with the leaders, your pastors, the institutions, your schools, the churches, the individuals, everybody is expected to be part of this ministry.
Ano kuruga nanye mgende ndi mkwama nongende sunati dongere kaya do pitfini karenya simsita mgende sgokanguki nosure nonombonga nati nyeda hamena mongereka.
And what do we do inside the ministry?
Ano ingi hatu kuruga nanye mondaje zosuruga nesi.
We deal with HIV awareness.
Ano se kuruga nanye kumenye ne division loko hamenanye uvera ukambongorgo
Around Rundu, how many posters do you have that are talking about HIV around Rundu?
Ano morundu nyomunye nombonga dinga mwadiva ndokuyunga ko hamena HIV edi mwadiva.
Do you have any?
Makara kona na dimwe?
No. There was a time that everywhere you turn there was information on HIV, right?
Ano kosili stro sakere konye kenye kumenovra kuzan ndogwana nombuti doko hamena HIV.
Now we don't teach anymore.
Ano ngesi kapyati rongo hena.
And the results of it is what I showed you this morning. The HIV is going up, the troubles are going up. My time gone. Because I haven't even started, I'm introducing. Anyway, so we deal with prevention, we deal with care and support. He says I should wind up, so I'm going to do just that. Okay, but that's what we are doing. So we do with awareness. If you can't do anything else in your church, you will do awareness. Okay, and our symbol, official symbol, looks something like that. We have the red ribbon, like the HIV ribbon, and we have it baptized with the 3 flags.
Ano setu akaranye no si mbara nyo so skeha ano kumenya no marubaro kukumaki akakarako.
What are the key departments that we work with?
Ano no mbunga msinga kurukuruga na kumenado.
Anybody from ministerial, pastors and elders, do I have any?
Ano to akara no wasita no wakuru na pongeromo kachiketu.
Pastors, elders, you are part of AIM.
Ano no nama hamena nye mbunga is the aim.
Do I have the youth? I can see you. You are in AIM. I see women. My ladies, we are there. And children. In other words, everybody. We do different things with different departments. When you have time, I can work with past ministerial to show them their role. Each and every department has a specific role to play in AIM.
Ano numbunga na dinyenye da hamena monye say atvuruguruga na we.
How do we work?
Ngapi atvuruguruga na?
We do education and training like what I'm doing today.
Ano se kuruga na ye elirongo ndani no made oronga mumta kuruga na nena.
We have a number of prevention strategies which I was hoping to talk about. I don't know if I will. But this t-shirt comes from one of the strategies that we are using.
Ano to akara ye nongende so stime dokturi saponye doko hamena kanda na soponye na kukuwa singatan kai wenga nena nye no suru wesikap nadia sana nan kai kuma.
Of course we are in the hospitals. The church has got many hospitals and clinics where we do care and of the infected, and we do give ARVs and all other things that are there.
Yo siri ngongere katwakara no ipangero no klinika wa mwatu furukuruga na yuko hamene pakero mbili no mwa furuga
we have support groups that also care for those who are sick at home. We follow them up, we bath, we do all sorts of things in them. We organize churches to be active ministries where they are. We are a resource department that gives all other departments what they can do. That's why we call it mainstreaming in other departments. And we are a department that actually collaborates with others. For example, we've got ADRA here. Tomorrow they'll talk to you about how they are collaborating with AIM. We form partnerships even with non-Adventists out there because we are working on something. We have booklets like this. This is handouts, and I have some of them. Somebody can help give out those handouts there. This is part of the education material. We produce and print out education material. No, just the paper, yes. The pen will remain behind. Yeah, so we can give you the soft copies. Like this thing, we can give you the soft copies that you can print in your own church. We have a whole lot of other things that we give to you. We teach on preventing HIV and AIDS. Of course, we teach you. Today I have to rush through to say, first and foremost, let's not be afraid of people with HIV. HIV can be spread in specific ways. So we teach people to appreciate the different ways that HIV can spread and show them that if you avoid those fluids in all those areas that are listed there, you can then prevent HIV. It's part of prevention strategy for you to get tested. If you know your status, then you know what to do. So as a church, we encourage people to get tested. We know that many of our churches run some form of health expo. We encourage you to collaborate with people who do testing in the right manner so that you can have testing at your expos. We want the women ministry to do that. Encourage their women who are expecting, if they are HIV positive, to take their medication to protect their children. Please take this message out, because we are having children born into the Adventist church with HIV because somebody somewhere told people it's a lack of faith to take ARVs when you are pregnant and now the child is born and they have HIV. What do we do? Please. Many of our countries, including Namibia, subscribes to this, right? ABC. And A stands for what? Abstinence. What does that mean? Abstinence from sexual contact, right? We as the church uphold that. And we go on to B. B stands for be faithful. Who is it talking to? This is where it gets in the bush in the church, right? He's talking to married people in the church. Remember I said biblical principles. Out there, your government will rightfully tell you, be faithful, stick with one partner, right? In the church, we say,